Hi, I'm Dr. Rahman, and welcome to Black Women's Health. In this episode, Valerie Yamina Bey, the reproductive health alchemist, discusses her treatment plan for women dealing with fibroid tumors. Take a listen. Here we go. Your story is fascinating enough, but I can imagine women at this point are salivating with, well, what about me? What can she do for me? All right. So,
Uh-huh.
so to recap, you had all the symptoms, heavy bleeding, pain. You had the diagnosis of fibroids. You went the traditional allopathic way. You had birth control pills. You had a myomectomy twice. And the results were less than satisfactory for you, meaning that you still
Mm-hmm.
bled, you still had pain. And at that point, you decided you needed to do something else.
Yeah.
This is where the story gets interesting. Your choice was to seek out another type of healer. You went with
Mm-hmm.
someone that was using energy, and this person was able to provide you with an explanation as to what was going on in your body.
Yeah.
So I guess my follow-up question to that is, what made you feel capable of healing yourself, which is what you basically did?
Yeah. Because of my prior training as a nutritional therapist, um, my training as a detoxification specialist, my training as a raw food chef, literally everything I've done came together.
Okay.
And I thought, right, I'm going to utilize everything I've got and I'm just going to package it up for myself in a way that I know best. Because obviously, I've been doing this stuff for so long that it's just part and parcel of my life. So all I needed to do was say, right, okay, now I've got all this information, I know what's going on with me. So I know what I need to do. It was just the knowing.
Okay.
um
Okay.
that was the advantage. Of course, I do recognize that not everybody will have that experience, but
And
that's essentially what I did. I just used everything I got, all my knowledge, all my expertise, everything that I've been doing over the last few years, and I just took that and mapped it into a healing blueprint for myself.
And at this point, had you decided that you would no longer seek out allopathic treatments, or was that still a possibility?
No, not at all. I mean, when it comes to medicine and medical help, there are some things that you just can't do, you know. So if there was any test I specifically needed, I have actually been to doctors since, but that wasn't for fibroids or heavy bleeding. It was something different. Um, I've gone there for various tests, whether it was for my kidneys or my liver. So I still utilize it because, as far as I'm concerned, it's called complementary. What I do is complementary to
Oh,
what they do. You
oh,
see,
and
where they miss out, I fill in the gaps. It
okay,
I don't what I do. I don't aim to replace medical help. You know what doctors can do. That's not my job. That's not what I'm qualified. That's not what I trained for. I trained in the holistic route, which is looking in the other areas that medicine doesn't cover.
hmm.
M-
So
Make sense?
since since your successful treatment, of your fibroids, have you been back to the gynecologist concerning your fibroids? Have you had any follow up ultrasounds that would document my fibroids were this size at this point, and when I went back to check, they were smaller or gone?
The ultrasound is something I I have on my to-do list. I haven't been back since I think the last time I went for an ultrasound was well over 3 years ago, probably about 3.5 years ago now. And it's always been on my list to go back and just get an ultrasound just to see what's happening.
Sure, sure.
But so I've yet to do that. But trust me, it's on my list to do.
Okay.
And
Okay.
remember, we've got the NHS over here. So, and the waiting lists are stupid.
Really?
So for something like that, unless it's urgent, which mine isn't, you won't necessarily get an appointment. And many women over here now are turning to private.
Oh,
They're booking
don't do that.
private.
Don't do that. I mean,
Yeah.
uh,
Yeah,
it,
but it'd only be for an ultrasound, so
yeah,
it
yeah.
wouldn't that wouldn't necessarily be an issue. For an
Yeah,
ultrasound, that's not a problem.
yeah, yeah. There's
Yeah.
a lot to be said for free medical care.
Mm,
But at some point, you realized that what you were doing was working for you, which had to be a wonderful revelation.
mm.
Then you decided that you were going to start offering this to other women. And what prompted that?
The information I found out was too valuable not to share because I knew that there was gazillions of women worldwide suffering with the same problem. So I initially I wasn't doing it for that. I didn't do all this work on myself to set up to build a practice around it.
Mm,
Um because by that time I actually wasn't doing anything with my practice. I was just doing other things.
hmm.
But the information, I thought other people need to know this. So once I had enough evidence, I set about creating webinars to go and share what I've learned. Initially, I was just doing webinars as often as I possibly could just to share the information.
And what type of
And
information were you sharing?
I was literally sharing what the causes were,
Mm,
the root causes of fibroids, why they were happening. Because most women don't know. They say they are told that it's down to hormonal imbalances, the heavy bleedings down to the fibroids, and etc. etc. But those are just symptoms of something that's underlying, which is what I've already mentioned to you, which in regards to the toxicity. Um, I was dehydrated. There was a whole load of stuff going on that women may not be aware of.
hmm.
And unless they have a kind of energy reading or a test, whether it's a blood test, because I know there's tests out there that you can do to pick up on underlying root causes as well, which involve urine, sweat, blood, and things like that, which is done by various labs. And I'm affiliated with some of those labs as well. So if they wanted another way to do it, they could do it that way. But so unless they have something that actually documents what the root cause is, they're not going to know. So that's the kind of information I was sharing. Um, just saying, right, okay, this is the issue. And also, I was sharing the fact that because when you're looking at the biochemistry, something I haven't really looked at since I was at school, but if you looked at our biochemical structure compared to other people, you see that we're very, very different. And because of that, because of what I learned in my holistic training course, which is specifically geared towards the health of Black people, even though I don't like using that terminology, but I use it just for now.
Hmm.
I, I realized that actually, because of our chemical structure, this is what I was sharing in the webinars as well, because of our chemical makeup and the fact that actually we do need the sun in order to create health, if you like, especially for vitamin D, because vitamin D supplements, um you can take them but they just won't have the same impact as the sun. But then in order to utilize the rays and not get burnt like I used to, you've got to clean up your insides. Otherwise, you're just going to go out in the sun and it's going to hurt you.
Mm.
And also, not to mention the fact that we need to eat differently as well. If we're, I remember somebody saying, calling us the sunshine people, because if you look at globally where most of us reside, it's in places that have sunshine. So that got me thinking, well, surely that means we need food that's sun fired rather than food that's grown underground, because our skin, this is not me saying it, this is what I've read in studies, our skin is like photoreceptive. So that means we need light. So I think, okay, and we know that so many women out there, not just our people, but loads of women, not only are we iron deficient, but we're vitamin D deficient because we're not getting out in the sun. And then when we do, we put on sunblock.
Mhm.
You see, there's you need the sun to make the vitamin D, but then you don't want to go mad and end up having too much sun, because there's too much of a good thing, so to speak. You do need some respite from it as well. So
So,
that's what I realized. We not only, so the food we're eating is not helping because it may not be the right food for us, but also we need to really, really look after our body. So also I was sharing some self-care techniques as well. And then one of the biggest things I learned about, um, and I really love Dr. Joy DeGruy. I don't know if you know her, but she wrote a book called Post-Traumatic Slave Syndrome.
mm,
And when I read that, I've read that a couple of times now, and I've also watched her videos on YouTube. So if you haven't heard of her, go and look her up,
I
because
will.
her stuff and sorry?
I will. I definitely will. Check.
Yes, yeah. Look her up because she is absolutely excellent. When she was explaining the trauma that we faced, it made so much sense why we're just continuing to suffer. Our health is continuing to suffer, is because much of it is to do with the hidden trauma many of us aren't even aware that we have. But because I've done so much of my own healing, I can see it clear as day, even though other people may not. I wouldn't say I'm fully healed, but I am definitely a long way into my journey. So it's easy for me to see where where there's trauma, but people may not necessarily realize it. So when it comes to dealing rather with fibroids naturally, it's not a case of, yep, take you're one and done with the supplements. It just does not work that way. So
All right.
this
So,
is
so walk me through a process. I'm a woman. I know that I have symptomatic fibroids. I've tried allopathic medicine, or I haven't tried, but I want to try a more holistic approach.
Mhm.
What would you do? We're having our first encounter. What would happen?
Right. So the first thing would that you'd get an assessment. I Nothing starts without having your assessment. So I do that using the what I call the EUC framework, which is exploring the underlying causes. So essentially, we need to, this is exactly what I did. Okay, everything that I do is what I did, and I put it into a program called the HAP method, HAP,
So
the hysterectomy of.
is this a conversation I'm having with you, or are you doing some sort of body work? What exactly does the
Yes, it involves a.
framework involve?
Yeah, so it's a conversation initially. So initially somebody would get on the call with me and I would, which is my I just give a free call
Mm-hmm.
to establish what's going on.
Mm-hmm.
So if then she would say, okay, yes, I want to work with you further,
Mm-hmm.
this is where she would move into the HAP method, which is the hysterectomy avoidance protocol.
Okay.
Okay.
Okay. What does that involve?
So this is where so essentially the free consultation is where we set out everything, what's going on, and exploring what might be what's happening with her. But when we get into the program, this is where we get deep and dirty, so to speak. So this is where in the initial, before we do anything at all, I will get my client to complete a set of assessments. One is where we'll go through the assessments so we know where they're starting from. So this will be whether it's I plan on using the readings, energetic readings for myself because I found them so effective. So these are initially what I call my diagnostic assessments. I'm not diagnosing anything. They're
Are
just
you
a holistic approach to
are you
treating the whole
able to
person.
do energetic readings now, or do you send her to the other practitioner for that?
I do them.
Okay.
I do them now. I used to actually have work with somebody who did those readings for me, but now I do them because I need to see everything.
Okay.
Absolutely everything. I need to see exactly what their body's doing. And the thing is, I don't do one reading. I will do a series of reading because
Mm,
what I'm doing is I'm looking for anything that doesn't change.
okay.
You see, so I may do a total of 5 readings, maybe 10 readings over 10 days, stuff like that, because what I'm looking for is there something that is not changing from day to day? Because you know our body shifts from day to day, so your readings will never be the same.
So if it
So
doesn't
that's what I'm looking
change,
for.
that's implying there's some sort of blockage.
It would imply that there's something going on, not necessarily a blockage. That's where my investigations would come into play. So if I've spotted, for example, in the liver, if there was a reading in the liver for the phase 2 detoxification and it was constantly on red over 5 readings, so to speak, then I would do some deeper digging to establish, right, what do we have going on here? That's where I would use a more comprehensive scan. So my scans, the ones I use, the what I call a comprehensive report, it looks at the body in a much deeper way. So you're looking at DNA, you're looking at bones, you're looking at hormones, nerves. Essentially, digs deep into the detail. So every little bit of the body it will look into, and it will show me exactly where, for example, in bouts in the liver, why that detoxification mechanism is going wrong. And
Okay.
then that's where I start asking questions to the client to say, right, okay, what might be going on? Is it her diet? Yes. Is there some kind of blockage there? obviously I would look for red flags, because anything red flag, she would have to go to seek medical assistance for that, because there's some things.
Oh, that's a
Oh,
good point. That's a good point because you are not considered a medical practitioner, or are you?
no,
You are
and I
not.
don't claim to be one.
Okay. And so if you do an assessment and you identify some area of concern, you will then tell that person to seek out medical care.
Yep, it's the ethical thing to do,
Do you
because I
ever
know there's. Hmm.
tell a woman, I don't have anything to offer you. You really need to have that surgery or take that medicine.
Yeah, if I do say to women that they need to get real. Again, going back to what I mentioned earlier about if they've got multiple fibroids and they're large and they want to try and shrink them or eliminate them the natural way, they're going to have a very, very long journey. The best way, as much as somebody might hate to hear it, is to have them out via surgery. I do not regret my surgery. I am so glad I had it,
Hmm.
because it does give you a clean slate. The only issue is I didn't do what I did earlier,
Mm,
you see. And I think I would have had a much, much better result had I started doing what I did much earlier, but I didn't. And here we are. But for women who are suffering that, and they've only got small fibroids, or they just want to deal with the heavy bleeding and the fibroids aren't too much of a problem, then yes, not an issue at all.
so
So long as they've been done. Hmm.
do you have criteria where you say, no, I am not able to help you at this point? Meaning, if her hemoglobin, if her blood count's at a certain level, you will say no. If the fibroids are of a certain size, you will say no. Do you have that criteria already determined?
I don't refuse to help somebody. I can certainly help them if as certainly if they're having some kind of medical treatment alongside that. I am happy to work alongside that. So but when it comes to general health and wellness,
Yes.
I will specify if she's got any other goals, because if I will be honest with her and say, right, okay, what I can and can't do, because that's only ethical of me to do so. And I don't want to give anybody false expectations.
Sure. Okay. So let's say, I've come to see you, you've done my initial assessment. You are of the mind that you actually can help me with my fibroids. We
Mhm.
do the energetic evaluation, and you've identified the areas that need to be worked on.
Mhm.
What happens next?
That's where we start setting up what it is she really wants, because my program is bespoke, it's tailored. So even though there's a structure to it, it's really geared towards what her goals are. So will probably create a wellness vision. So we go through that and say, right, what are her goals? What does she really want?
All right, let's say my goal is to
Mhm.
stop having these heavy periods.
Yeah. So then we'll need to break down what that means, because that's the goal. But we get to say, right, what are the steps to get you there? What's your diet like? What's your sleep like? What's your
Mhm.
hydration levels like? What are your stress levels? We need to dive deep into the lifestyle
The
to see
lifestyle. Hmm.
what areas are potentially impacting on that. You see, as well as having the scans to say, right, okay, your hormones are all over the place. Okay, why is that? What are you eating? What's your diet like? Again, it all comes back to the simple things that people find really hard to do, especially when it comes to food.
Food. Yes.
You
Yes.
see,
That's a
it
big one.
really is as simple as that. So what I do is then together, rather, we map out a plan of action using those tools, and I have a load of checklists that I go through. I've got checklists, audits, various assessments, trackers.
So as
Um,
your client, how often am I interfacing with you?
right, so it's twice a month because there's a lot of work to do. I'm not going to beat around the bush and mollycoddle it in any way. There's work to do. And anyone who works with me have got to be prepared to put in the work. They've got to be dedicated and absolutely committed
What do
because
you mean by work? What is the expectation?
so essentially if there's an exercise, I will have an exercise for you to do. So it could be a case of monitoring something, monitoring your quality of sleep, tracking how much water you drink,
Mm-hmm.
um, writing a food diary,
Mm-hmm.
um, clearing out your kitchen cupboard,
Mm.
or
Oh,
noting down what you've got in your kitchen, and then, or writing down how you feel after eating something. Do you notice if that particular thing you eat it affects you adversely? You see, so it's a case of turning detective, if you
yes.
like.
Yes.
You've really got to start understanding your body and how it reacts to certain things, everyday situations, how you react to somebody who just, says something to you. Do you react or do you just brush it off? It can be simple things like that, but they need to be aware of absolutely everything because it's all going to have an impact on your overall health and well-being.
Mm-hmm. And so, um, and I know this is variable, and I there isn't a set answer. But if I start the program with you, my problem is heavy bleeding due to fibroids. We
Mhm.
do the assessment. I do the work. I'm willing to do the work.
Mhm.
Can you give me any type of estimate as to when I should notice an improvement?
Well, yeah, if you've done the work like you said and stuff like that, it's going to vary. There are no timescales for this. There really aren't. You may notice, so somebody who works with me may notice that over a very short period of time, they get what you call micro improvements. So they see their skin looks better, they may sleep better,
Mm-hmm.
um, they might find their overall energy levels are improving. They might lose a bit of weight, even though that may not have been
Mm-hmm.
one of their goals. So you'll see all these other things that are improving, but you can't tell your body to do something quickly because, as you probably know, it takes what, roughly about 3 months for blood cells to be replaced. So, and then I think it's another 6 or so months for bones to be replaced, to break down and be replaced. So it's something like fibroids, especially if you've had it for a period of time, maybe it's 5, 10, maybe 20 years. 4 months working with me is just like a little dip in the ocean.
Oh, okay.
Um, but you can make extraordinary strides just in that period of time. But I'm going to be totally honest, it took me a while. The thing about the program I've created is that I've speeded things up for somebody else, because obviously with me it was, I knew what I was doing, but it was still trial and error. I was thinking,
Yes.
right, try this, let's do that. So all I've done is I've condensed it into a 4 month
A 4 month program.
slot, so to speak. But
And the
don't
patient,
expect.
yeah, that's what I was going to ask. What is the expectation at the end of the 4 months? And I know it's variable. There's so many compounding factors. What the cause
Mm,
is, the willingness to do the work. But based on the clients that you had in the past, what type of success is really not a good word. What type of responses in what type of time frames are you seeing?
yeah, that tends to be a question I, to be honest, I don't really like answering, because that is the expectation of time when it comes to chronic uterine conditions. Again, I just can't. I don't really want to give false hope. I don't
Hmm.
want to say, well, yes, you can expect this,
Okay.
because I don't know whether that's going to happen. It might not. And I don't want to leave anybody disappointed. That's not to say they won't get any results. But again, when it comes to heavy bleeding and fibroids, like you said, it's variable. And because I have been asked that question a lot, especially with the webinars I did between lockdown and a couple of years after that, because I did a lot of webinars in lockdown. And that is a question I got asked over and over again. When can I expect to see some results? And I think it stems back to the fact that when we go to doctors, they give us a pill, and a couple of weeks later, or a couple of days later even, we're feeling better. And I think it goes back to that. We've got this expectation that, okay, when we go to the doctors, we know that, or we have a myomectomy, for example, we know that in 6 weeks we're going to be fine. In fact, that wasn't the case with me. It took about a year for me to properly heal.
Mm.
Yes, I was okay. I was up and around in 6 weeks, but to be fully healed, it will take about a year, you see, but people don't think about that. They don't, because we're given these time frames to say, right, okay, um,
And,
you've
and,
got six
and
weeks or
I
eight
think
weeks.
that's true. I think our expectations of when we will see a result is very, um, we want to know. But I think the other confounding factor is cost. How much does your 4 month program cost a woman, and how long will I be involved in this program? Those are all factors that have to be considered when someone is deciding if this is something they want to do.
Okay, let's put it this way before I move into that. I think this was last week. Actually, I was in a group on Facebook, I think it was, and somebody asked about private medical care for her fibroids, or whatever she was asking about.
Hmm.
And one woman responded, and she said, I think it was, oh, actually, I think it was for a hysterectomy. And she said, all in, this is in pounds, not in dollars.
Hmm.
She said it cost her about £14,000. Now, if I was to translate that, I would say that was probably about $17,000.
Mm.
That was all the tests and whatever, plus the procedure and etc. etc.
Hmm.
And I was actually speaking to my other half, and I said, can you imagine somebody's paying? £14,000 to have a womb removed. And I said, what I charge is not even a fraction of that.
Mm,
I said to actually keep her womb in, and she'll probably get better results,
mhm.
you know. And so, but yeah, my especially my diagnostic assessments, they start from about £29, which dollar wise is, I'd say it's roughly about $35.
Oh,
So
okay.
it's from that. So it's the diagnostic assessments
Yes.
are very, very affordable, but the actual main program is very, very reasonable. You're looking about 1200.
Okay. Okay.
You're looking
And
about 1200.
that's the 4-month program.
Yep,
Yeah, that sounds
that's the 4
reasonable
months.
because um, although the focus is on the fibroids and the heavy bleeding, I can imagine that there are all of these secondary benefits and gains that a woman receives along the way. If you're eating better, if you're dealing with your stress and your emotional state, all of that is an improvement that you're going to see evident in other areas of your life, not just
Eh,
with
Yeah,
the bleeding per se. So
exactly. So, but there are women out there who are absolutely determined no matter how long it takes, and they do realize that it's a long journey. It's a journey that once you start on doesn't actually end. It's it's a lifetime thing. I think looking after yourself in general is a
yes,
good thing
yes,
anyway. Small, I normally get women who, like you say, they're at their wits' end. And if, again, if they just want the problem gone, I can't help them with that.
yeah,
That's not my speciality. That is medical care. That is something I cannot offer. And I'm very, very clear on that. There is only so much I can do. If you're willing to put in the work, you're determined, you've probably had an operation and you know you don't want them to grow back. That is where I can help. I can step in and help.
yeah,
But if you've reached a critical situation and you cannot take anymore, then the medical route, having a myomectomy or hopefully some other wound saving surgery is the only way to go, essentially. As much as some women may not want to hear that, may be disappointed hearing, but that is the absolute truth.
we wrap this up. What would you like women to know? Is there a way people can get in contact with you? What would you like to share with us?
Yes, so I have a website. So it's a shortened website. So it's Womb Wellness Warrior, but it's HTTPS
Mhm.
semicolon double slash bit.ly/womb wellness warrior, all one word. Um, and then also I've got a free toolkit that women can download as well, because this is something that they can use to help them start assessing what's going on. It's a starter kit, actually. It's got a diet and lifestyle assessment, as well as another assessment that tracks their, stress and monitors symptoms, shall I say. Yeah, so they can download that. That's like an 11-page document where they can use that to start assessing their root cause, because they need somewhere to go. Because what I see a lot is that there's a lot of guessing. They don't know the root cause, but then they go out and start self-diagnosing, and then they go into groups and start asking for recommendation for supplements for unqualified people who then just throw out random supplements and, oh, this is what I use.
That happens a lot.
It all the time, and it frustrates me because they this is where they start saying, oh well, I've tried everything, nothing's worked. Whereas actually they may have tried a lot of stuff, but not necessarily stuff that will work because they haven't done the groundwork, so to speak. So I would say definitely download the starter kit to help you on that road, so you'll have a better understanding of what's going on, whether it's your diet that's affecting you, and then you can start assessing from there as well. And then you can find that at my website. If I grab the link, if I can send these links to you,
Sure.
um, and then then people, if they're interested, they can have a look and then they can download it from there. They can sign up and download it.
So there you have it. She's not a medical practitioner, doesn't claim to be. She gives you no guarantees, and she tells you that it will take time. It will involve living a better lifestyle, dealing with your stressors, detoxifying, and eating better. All good. So I have no problem suggesting that women who are dealing with fibroids consider her program, find out what she has to offer. Decide for yourself, are the benefits great enough that you would consider, or are you ready to do something else? Again, this is just another option for careful consideration. As always, I advise that you discuss any change in your medical plan with your gynecologist. Be sure, ask questions, do your due diligence, but definitely give this a consideration.